Donna Brown Newton is a mother, a grandmother, an activist who believes in affordable health care, a livable wage for all, and a free and equitable public education system. That's one of the reasons why she's running for the newly created House District 80, which is in Mount Pleasant. I speak exclusively, Donna, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Donna Brown Newton, welcome back to Quintin's Close-Ups.
Thank you for inviting me, Quintin.
You're very welcome. You know, the last time I interviewed you for Quintin's Close-Ups was 2 years ago when you were running for House District 99 as a Democratic candidate. But because of redistricting, you are now actually running for the newly created House District 80, which covers most parts of Mount Pleasant and other areas. In fact, on your website, you said that you are a mother, a grandmother, and an activist that believes in affordable health care, a living wage for all, and a free and equitable public education system. Tell me why Donna Brown Newton, why House District 80?
Well, thank you very much for that question, Quintin. District 80 is because it's not by choice, it's because the representative that created this district is only, the good part about it is all covering only Mount Pleasant. The last time when I ran for District 99, it covered Mount Pleasant, and Charleston and Berkeley County. So that's the good thing about this is it's only covering Charleston County. And District 80 is my home. I've lived here in Charleston with my family we have been here for over 5 generations. So I know Mount Pleasant. I love Mount Pleasant. I'm a native Mount Pleasant, and so are my children. So that is one of the reasons why I'm excited about District 80 being in Mount Pleasant.
Now, you said obviously that you believe in an affordable health care. Let me go right to that, Donna. What health care problems in the state of South Carolina have you identified thus far that might cost less for the average payer later when it comes to affordable health care?
Well, mainly just having health care at all, because the majority of South Carolinians do not enjoy the benefit of being able to go to a doctor for minor ailments before they become serious. A lot of people use the emergency room as their form of health care. So just being able to go to the doctor and having a regular exam, like for women have an annual exam, for seniors when they get to be in their 70s, 60s and 70s to have that prostate examination. Just basic examination will help South Carolina have a better life, even for pregnant women are unable to go to have regular prenatal checkups. So just having those basic things will make it much better, and we make South Carolina a much healthier state for all of its residents.
Now, in District 80, Donna, how many healthcare problems have you identified thus far?
Well, District 80 is in Mount Pleasant, as you know, which the average income here is $90,000 a year for majority of newcomers that's just new to the area. But as the regular citizens who've been here, like myself, for generations, who don't have the luxury of having a job with healthcare insurance, it does not cover the majority of this area that I will be representing, but it covers a lot of Mount Pleasant that doesn't have the benefits of having a job that covers the medical needs of the residents. A lot of people in this area has service industry jobs. They work for places like fast food restaurants or in bars and the local restaurant area in Mount Pleasant. Even if you work, say, making the minimum wage, you can't even afford to get outside health care. So it's important that South Carolina expands the Medicare for those people who needs and requires to have some sort of coverage for themselves and their children.
Now, are they having healthcare problems with breast cancer in District 80?
Well, yes, because actually in District 80, women are also suffering from breast cancers. But the majority of people do have health care coverage here. Some of the majority of people do. So they're able to, if you receive Medicare or Medicaid, then your your annual mammogram is covered. But a lot of people don't even have that to get that coverage. So the numbers I'm not sure what the exact numbers are for uncovered breast care in District 80. That's one of the things I definitely will be checking into to get those numbers uh, for women that suffer, women and men that's maybe suffering from breast care that's not being covered.
Now, is there enough access in the area for this?
Enough what?
There's enough access for this as far as breast cancer care?
Well, we have Medical University, and which is here, and Roper Hospital. So for a town this size, we actually do have two hospitals. So it covers a wide range of different procedures. So I think the access is here if you are able to get to it, which also has access with if you're able to get transportation to get to see the doctors and the hospitals that are here. Because of the lack of transportation that we have, public transportation it's over here. A lot of people is unable to get just to the regular doctor's appointments because for either not having a car or not being able to afford a car service. And with there not being any public transportation, especially in the outlining areas of Mount Pleasant, it's almost impossible if you even if you have medical coverage. Like I said, Medicare and Medicaid will cover that, but if you can't get to the doctor the service, that creates another barrier for you.
Now, where in those outlining areas of district area do you need actual public transportation right now?
Well, it's like the area, like I live in example, I live in the Snowden community, and there's no bus service here. In order to get a bus, you would have to go all the way to Highway 17, which is almost 3 miles from where I live at. So imagine trying to walk 3 miles to get to a bus. Then once the bus take you near the hospital, in some areas you have to walk at least a block or more to get to the hospitals if the bus even comes. And also living in this area, the nearest hospital, which is East Cooper Hospital, is about 3 miles from here. So it's a little trot. There's no bus to take you there. So you still stop, even the hospital is 3 miles away from this area that I live in. It's still difficult to get to if you don't have proper transportation to get to these areas.
Now, obviously they have, the Route 40 and, the Route 41 and 42 in the Mount Pleasant area. But what alternatives to public transportation would be ideal for your district right now?
Well, it would be if they had the shuttle buses that would come through the local communities and pick the people up to take them to the area. Say a shuttle bus would take you to Highway 17 to get the 40 bus, which is actually it goes up to Wando High School.
Right.
But the idea is getting there to the bus to get to that area. So maybe a shuttle bus or some sort of car service that's more affordable, because certain times of day it's impossible to be able to afford to drive a ride for a Lyft or even a Uber.
Right, that's right. That's exactly right. Now, going back to the affordable health care, Donna, how would this affordable health care affect the state's budget?
Well, it wouldn't actually affect the state budget because, first of all, the federal government has given the states extra money to cover that extra additional cost. What happened in South Carolina is the Republican establishment decided to not accept the money to expand Medicaid, which would help poor people with lower income families to afford the medication and the medical needs all these families. So I don't think it will not affect South Carolina budget, at least right now, according to how it's set up for the next 3 to 5 years. Within that time, I believe that it will be South Carolina will save money along the line because can use that money as it builds up its own Medicare fund to help the people. And also, if we raise the minimum wage to a fair living wage, then the residents of South Carolina will be able to contribute more to that budget
Now, I
in the
want to get
long
to,
run.
oh yeah, and I want to get to living wage for all in just a second, Donna. But let me go back. Okay, if in 3 or 4 years, how would this still affect the state's budget, affordable health care?
We should be able to find a way to uh, to put in the budget for the residents of South Carolina for better health care. There's no way that we cannot arrange some items in the budget. Maybe if the state would stop fighting for certain issues like that's non-existent, like voter rights, or also fighting for a more gun access, they would have money in our budget for things like Medicare. So just stop fighting for issues that doesn't need to be fought, that cost so much money. We can use some of that money to go toward providing health care for the residents of South Carolina.
What type of fund would you create for affordable health care now that they have not accepted the money from the federal government?
Well, it's not too late to accept the money. South Carolina right now is almost impossible for them to do it right now out the gate by themselves. So the first step would be to accept the money that's already there. And then as we go along in the legislation, we can figure out where we can find the money to help cover the cost, the future costs of making sure the residents of South Carolina are healthy and able to have access to proper medical care without using the emergency room as a form of a primary doctor.
Now, what would those future costs be for the average constituent in District 18?
Well, we're not talking about raising anybody's taxes, so I don't think that would be an issue as far as affecting the people. Just what happens is just the money can be reallocated to cover Medicare. I think the residents of District 80 believe that everybody should be entitled to affordable medical care when needed. So I don't think that would be an issue for the residents, because it will not be affecting the taxes anyway, because the money, I believe the money is already there that will, without having to raise any taxes, what we have to do is shift some things around, prioritize different items, and then make Medicare a priority for the residents of South Carolina. We will find the money. The money is there. I know it can be found.
Well, what particular pork projects right now in your district that you would eliminate to allow that money to go directly to affordable health care?
Well, I would not take the issues here in District 80 is too valuable for us to remove. I don't think we have any pork issues here, except for maybe rapid growth, where slow down on some of the growth we have, or find a way to cover that cost from the developers that are coming in the areas, can cover some of the costs that would be normally covered by the residents of District 80. Say, example, for covering sewer costs for some of the areas here that don't have sewage, which is unbelievable. We have some areas in this community that do not have sewer. So we need proper sewer separate systems for the area. So that would make a difference without taking money from someplace else, just sort of reallocating, because I think District 80 is sustainable enough with the residents we have here to help cover all its residents for affordable health care.
Now, what initiatives or incentives do you want the developers to bring to District 80 besides obviously helping with those sewer costs?
Also, sidewalks. That's another issue. A lot of areas, we have a lot of rural area in some communities that don't have sidewalks, don't have proper roads. Some of the roads need to be repaired, expanded. They also need, when they come in the area, things they can do besides just sewer, they can create roads, alternative roads, without going to so many of the established community that's here right now. Because usually when developers come in the area, they want to build a road, and in most cases it is through the African American community, which is has always been affected with development coming in. And I had somebody ask once before, is why do the people in the African American communities build their homes so close to the roads and highways? I tell them all the time, the homes have been here. What they decide to do is build the roads right through through certain communities, which makes some residents home right next to busy highways.
Okay, Donna, let me ask you this then. What communities in District 80 need to be enhanced, elevated, and protected in the future?
I will say definitely the Snowden community. The Snowden community right now is actually the last settlement community in Mount Pleasant that doesn't have a subdivision in the middle of its community. These settlement communities, we have over 10 communities in Mount Pleasant that's considered settlement communities. These communities have been established by for generations, and it's built in a pattern for people for protecting themselves in these certain settlements, as they did in the 1800s. Homes were built this way, and these homes here are still built that way.
Mm. Yeah, and I hate to be redundant with this, but what African American communities in your district need to have those same, enhancements and elevations?
But like I said, Snowden, Phillip,
Oh, yes.
those are in the District 80, but we have more areas here in Mount Pleasant that need to be uh, protected. Also, there's a 4 Mile community. There's
Yes.
10 Mile right now, which is some part of 10 Mile is in District 80. They're having issues. They just went to county council to discuss the issue they have regarding a development wanting to build in their community, and cut down over 80 historical oak trees in the community. As
Mm.
of right now, it's been denied the development in that area for cutting down those trees and building those additional homes there. Hopefully, like I said, there's several communities that's endangered in the Mount Pleasant area, aside from the ones that's in the District 80. As I stated before, Snowden is the last community in Mount Pleasant that still is intact without major development in the middle of it.
Well, okay, let me ask you this, Donna, then. What's more important for your district right now? Building new homes and commercial space, or rehabbing, expanding, and better utilizing the existing homes?
I would say what we need is affordable homes. If they want to come in and build affordable homes, or repurpose some of this areas we already have here. Some of these homes we already have. They can repurpose those so make it affordable for people to live. We have places in Mount Pleasant where people live, people work, they can't afford to live. We're talking teachers, we're talking firefighters, police officers, we have service workers. So what we really need, you can repurpose some of these or as existing property we have here. And also, if you want to build homes where the people that live and work in the community can afford to live. The average cost of home in Charleston County is $1,500 for rent. So when you are making only $12,000 a year, it's impossible for you to even have a place to live in basically in Charleston County, let alone in Mount Pleasant and District 80. So we need to build homes for people to live, professional people to live, average people to live. So that would be the things we need to do: build homes for people can afford to live in, and also repurpose some of the development that's already here so it's affordable for people to live in.
Where would you repurpose that development right now? And what areas of District 80?
Hmm, that is a good question. Well, they had a hospital that they turned out that's a senior citizen, so they did repurpose that to a senior center, a senior citizen home that's there down here near the port
Oh, yeah.
where Roper Hospital was located before. It's just areas, even areas here in Snowden, that can be used. There's area near Wando High School that can be used, that possibly be used to build these affordable houses.
Okay, well, how should Charleston County create a dedicated funding stream for attainable housing do development, development, do zoning and other planning tools?
Well, definitely cut down on some of the zoning, some of the development zoning. And also, we have a lot of restaurants in this area, which is great. It's good for the economy. It keeps people working. But Charleston County should also just reallocate some of the funds that they use right now and stop. And one thing they can do is take that money, keep using the spending on 526 that they're building, reallocate that somewhere because they've been planning that for over 10 years, and the price is getting higher and higher and higher. And also stop making bad purchases like they did with the Naval Hospital when they bought that, sold that, and bought it back again. So stop making better decisions in Charleston County, make better decisions on how they even spend the money that we have right now. That way we can use some money to go towards causes as far as helping families be able to have a place where they can afford to live.
Okay, with that money that they're currently using to obviously build 526, and we don't know the timetable of that right now, should they use that money instead to widen 526 East?
Well, that would help with some of the congestion on 526, especially because it rotates. In the morning, 526 West is where all the traffic is at. 526 East where traffic is all the traffic is at. Then in the afternoon, 526 West where all the traffic is at.
Yeah.
So expanding 526, that would help ease some of the traffic, especially in the morning and the afternoons and different directions of 526. Yeah. That money would be best used widening 526 we already have, than opposed to extending 526 that goes nowhere when they can do other things on main and other areas of the county.
Now, is smaller scale commercial development much better for House District 8?
Model scale development, I'm not sure. I've never heard that term.
Yeah, smaller scale, smaller. Much
Yes.
smaller.
Oh, yes, definitely. We need to just sort of put a brakes on for right now, and then start to get people more established in the area, and we can find out where's areas that we can also decide where we can find areas to build low income housing by just cutting down on some of the development in the area. I know that may not be a popular topic, especially for District 80, to where people are moving and coming in to Mount Pleasant Groves. We need to just slow down a little bit, rethink about it, and think of other things we can do besides just building subdivisions with 500 homes in it.
Where are people moving into Mount Pleasant when they move to Charleston?
Right now, they're moving to an area what they call North Mount. It's now called North Mount Pleasant because North Mount Pleasant has gotten so large. Yeah. Now we've identified as the south end, the beginning of Mount Pleasant. Then as we go further down 17, that area is considered North Mount Pleasant. So they're doing a lot of building there, which is in the Carolina Park area. That's a new development that's there. That's quite a few homes there. Right. That's in District 80. And that's where the latest development is going at there. So that's where we're at right now. I would say just slow it down a little bit, see what we got. Think about the people, the residents already here, are the people who would love to come here that just cannot afford to come here. People come here to work every day. And I know teachers and police officers and also firefighters would love to be able to work and travel maybe 5 minutes opposed to getting on the Ravenel Bridge or 526 just to get to and from work.
Okay. With these people who work in Mount Pleasant, where do they live? Arundel, McClellanville, Goose Creek, Hanahan?
Exactly. Those places, they go further out. Somerville, they can afford to live in these areas right now. They can afford to live in these areas. Hanahan, North Charleston, Somerville. Some people travel as far as the St. George area coming this way to work.
Yes.
And as far as Georgetown in the other direction.
Oh, yes. Yes, travel right through that area just last week. But let me ask you, what strategies would you implement that will promote the economic vitality and financial stability of District 8 while maintaining its residential character and preserving its natural beauty?
Well, we can preserve its beauty the same way they build. They can still build. Um, I would suggest for them, if I make it to legislation, that we work with the local, with the counties
Hmm.
and the local municipalities to develop a plan where when they build, when development come in and build homes, uh, build $500,000 homes, they also build at least $100,000 homes where people can afford, based on economical uh, ability in this area, people can afford to live.
Now, how many homes in District 80 have been actually developed at a fairly consistent rate?
Oh, wow. You mean low income is average homes and overall? The average
Oh,
homes here in District 80, not the average home, but they have
mhm.
for most people in this community in District 80, like I said, the average income here is $95,000,
Okay.
but that only represents maybe 50% of the people in Mount Pleasant as a whole. So when they develop, I would talk to, and we would work with the local municipalities and county councils to, when you build $1 million home, also offset that by building $100,000 homes. For you have to have a place for the people, for your average workers to afford to live. So I'd work with them to, for, say they build $100 million homes, can we at least get 10 or 15 uh, work working home for the average working family to live in?
I talked to a sitting, council member for City of Charleston, and I asked a couple of months ago. I said, "Well, hey, where is subsidized housing?" And they said, "Unfortunately, that's going away." But do you see that coming back? And if so, how could that be effective in Mount Pleasant in your district?
It needs to come back because I live here. Like my family has been here for over 5 generations. I have children who are professionals, who
Yes.
are business owners, and they cannot afford to live here. So it is something that is effective. I don't think it's going away because it's going to be needed. As long as there are people that's working, even if minimum wage goes to $15 an hour, as long as there are people working under, making less than $50,000 a year annually, we'll need places for them to live. And Mount Pleasant is beautiful, so why can't other people who makes less than $100,000 a year afford to live here and enjoy the beauty and the benefits and amenities that Mount Pleasant have to offer?
Well, let me get on that, and let me talk to you about that. Where would a living wage for all improve employment opportunities in District 80?
We we have a lot of restaurants here. We have a lot of supermarkets, clothing stores. We have the town center. The people in those areas, they come to work here now, but a lot of them can't afford to live here. So it makes a difference if these, like I said, the average income is $95,000 a year. That means people are going out eating in restaurants more, so there's more service workers there. But the service workers that are there can't afford to live here, so their life can be just as beneficial from the atmosphere we have here in Mount Pleasant.
Now, what is that atmosphere?
It is mm, family nearby. It is, like I said, we have 2 hospitals that's nearby in the area. There is restaurants down the street
Yes.
from where I live at. So it's a lot of amenities here that people can enjoy by living in Mount Pleasant. Just we have the Palmetto County Park here in District. This is in District 80.
Right.
We have the Boonall Plantation. People can explore and enjoy those areas. So there's a lot of things people can do in the area to enjoy. Just for the average person to ride a bike to some areas.
Now, a living wage for all, Donna, would reduce family dependencies on welfare in District 80 by what?
Well, there's not a lot of families per capita here in District 8. I believe that's on public assistance in certain areas. There's pockets of people that's on public assistance. So that would affordable wage would get a lot of people off the assistance gradually as they can afford to live here. So that would help in that manner.
Now, with living wage for all, Donna, consumer spending would increase by how much in your district?
It would increase consumer spending would increase. Price has gone up. I know we have inflation right now, but if you have more money in your pocket and less going towards basic living needs as far as home, if you're paying more than 30% of your income for home for you for you to live, and then it will be somewhat easier for you to go shopping, go out to eat more often, spend money in the local retail stores. But as it stands right now, if you're not making a living wage, it's impossible for you to enjoy the shops and the retails and the local restaurants in the area. So the moment that you have more money in your pocket to spend, it'll be easier for you to afford to go out and enjoy the amenities in Mount Pleasant.
Now, how much money is the average citizen or constituent spending right now in your district?
Mm. On average, I believe, um, I may be not correct. I'm based on the fact that I think the average resident constituent here spends I'm gonna say roughly on the low end about $50 a day.
Now, how diverse is the spending, or diverse is this economy in District 80?
It's sort of unbalanced because we have a lot of people, like I said, making above average wage,
Hmm.
and we have a lot of people who are making maybe about 25% of the people that's making below poverty are on public assistance for some sort of public assistance help, be it welfare or food stamps. Things.
Yes, ma'am.
Yes.
Yes, ma'am. Now, speaking of the economy, how many minority businesses do you want to create in the district if you're a state representative?
Well, just taking District 80 by itself, if we can at least get one right now, District 80 doesn't have any minority businesses in it.
Hmm. And what type of public partnership would you create to have more minority businesses in your district?
It would help if banks to be a little more amenable to giving businesses seed money to get started.
Okay.
That would help. Partnership with some of the banks and some of the local retailers.
Hmm. And quickly, while I have 3 minutes left on here, Donna, let me switch over to education. Obviously, that's your forte. You know all about that. Where exactly is quality education in District 80?
We have great schools in District 80. We have Bell Hall, we have Wanda, we have some of the top schools here, and we just built
Lucy Beckham.
Lucy Beckham. Um, Education, I don't think is a problem, but the quality education in Mount Pleasant is I consider to be excellent here in Mount Pleasant. But that doesn't mean all the children are getting a quality education. We still need to have some programs for some students because mainly we understand with the fact COVID opened up a lot of areas to realize that a lot of students did not have access to internet services. And even though they attended the great schools and the schools had services there, had computers and laptops for them to use, we realized with COVID shined a light on the fact that we had a lot of students that didn't have internet service. So we need to be able to find a way for all children to have access to the things that's maybe in the schools but not in their homes. So we
Well,
need, go ahead.
well, let me ask you this, Donna. Where would you put, say, fiber lines in District 80 for these people, in Snowden and Phillip who don't have access to internet?
Well, not to don't have the internet is there in this
Mm,
area. We're lucky that we have great internet service in our area. The problem is affordability. A
mm,
lot of parents, a lot of people in the district cannot afford to have, say, a computer or even afford to have purchase internet service because internet service can be very expensive. And that's where the problem lies that a lot of people, some of the residents here just cannot afford it.
And I hate to ask this question, but should the state of South Carolina make internet a utility?
Uh, to regulate the cost of it, yeah, it needs to be because it's expensive. If they had something, it should be where it's affordable for people. Some people, a lot of people in the area, I know that Comcast has a service for people who has that's on the SNAP program. They can get internet for reduced rate.
Right.
But there's some people that falls in between the crack area that they work, they don't qualify for any benefits, but they're just barely making enough to cover their needs, the regular household needs as rent and uh, other utilities.
Yes, ma'am.
So that's where the discrepancy lies at.
I want to continue this conversation, but they're kicking me off Zoom, unfortunately. But Donna Brown Newton, thank you so much for your time. And again, welcome back to Quintin's Close-Ups.
Thank you, Quintin, for being there. I want people to remember Donna Brown Newton, uh, Newton for the new District 80. Thank you. You can reach out to me at newtonforsc.com. Thank you, and I appreciate it.
And God's best to you this fall.
Thanks a lot.
You're welcome.